What are the best eye drops for dry eyes? Today on the eyefacts.com channel, we are talking about the best over-the-counter drops, as well as some of the prescription eye drops that you can use to help alleviate some of your dry eye symptoms. Now, there are actually over-the-counter drops that can make dry eye worse, and we're gonna get into that as well. Finally, at the end of the video, we're gonna talk about the pros and cons of the different prescription drops that are out there for dry eye treatment. So let's dive in. First of all, over-the-counter artificial tears. Now, there's many different over-the-counter or OTC artificial tears, but the best one of all of them is gonna be something that is preservative-free. That means it's gonna come in the little vials and usually doesn't come in just one big bottle. Now, before, I used to tell patients, just buy the cheapest preservative-free tear out there that you can find, but honestly, there have been so many FDA recalls lately about some drops having pretty serious contamination. So now I typically recommend branded products, and I've lately been recommending preservative-free Refresh a lot to my patients. And if you're in the eye doctor's office, you can also buy Oasis preservative-free, and that one is usually only sold in eye doctor's offices, so you may have to make a visit to your doctor to get those eye drops. Now, it's important to remember that some over-the-counter eye drops can actually make dry eye worse. And these are the Get the Red Out eye drops. So although they make your eyes look white and seem not dry, they're not actually lubricating drops. These drops are specifically designed to vasoconstrict the blood vessels inside your eyes to make your eye appear white. And this does not actually hydrate the eye. So while you can use them once in a while if you need to go out or have an important meeting, it's important to also use lubricating eye drops because these are not the same thing. The second type of over-the-counter eye drop is a gel eye drop. These eye drops tend to be a little bit thicker than the lubricating eye drops and the preservative-free eye drops. And the biggest pro to this type of drop is that it tends to keep the eye lubricated for a little bit longer, and so you may need less eye drops. Now, the downside to this drop is that sometimes the gel eye drops can be pretty thick, and so it can cause blurry vision for a couple minutes. Not a big deal if you have nowhere to go, but if you have to drive somewhere or you're in the middle of a meeting, this is something that is not ideal for you. A third over-the-counter eye drop for dry eyes that is a good lubricant and almost has a cream-like consistency is something that you will find that's usually in a tube. These thicker type of lubricants, you'll have to pull the eyelid down and you're gonna put the gel or cream right there into the lower socket, and then you'll blink the eye a few times to let it spread all over the eye. Now, the problem with these is similar to the gel ones is that they are very thick, so they do provide long-lasting relief, which is a good thing, but again, it can make your vision pretty blurry. So I typically recommend that my dry eye patients take this at night, right before going to sleep, and I actually have them put it right by their bedside so that they're already in bed and they don't need to walk around after they put it in. Now, in addition to over-the-counter eye drops, you also should have a heat mask to help treat any underlying blepharitis, and tea tree oil wipes can help also because this can help to treat any blepharitis that is associated with Demodex mites. Now, both of these options can be purchased over the counter. When you use your heat mask, it may be helpful to do a little eyelid massage to help loosen up the oil that's inside those eyelid glands. Now let's talk about prescription eye drops that can help your dry eye. There are 4 main ones that we're gonna talk about today. Now, these are all prescriptions, so you will need a doctor to prescribe them to you. In most cases, many eye doctors will attempt more conservative measures first, like the ones that I just talked about, before we get into the prescription medications, and you're gonna see why. I wanna start off by talking about Restasis and Cequa. Both of these eye drops are prescriptions that have the drug cyclosporin in them. And cyclosporin is an immunomodulatory agent that actually reduces ocular surface inflammation and actually increases your body's natural tear production. This is a big plus because we're not just replacing the tears, these drugs can actually help to make more tears. Now, there are 2 big downsides to these drugs. Number 1 is insurance coverage. A lot of my patients have difficulty getting these drugs covered, and so that can often limit if they're able to actually use them or not, because without being covered, some patients come to me and say, hey doc, this is costing me $300 a month, and it's not really a realistic option for me. The other major downside is that these drops, while they work, they don't work right away the way artificial tears do. CEQA can take 1 to 3 months before patients feel a difference, and Restasis can take longer, anywhere from 3 to 6 months. And it also requires that the patient be very, very consistent about taking the eye drop every day, even before it starts to really work and have an effect. Another prescription eye drop that you may have heard of is called Xiidra. Xiidra is also known as lifitegrast, and it works to improve dry eye symptoms, again, by reducing inflammation. Specifically, this drug lowers T-cell mediated inflammation on the surface of your eye. Again, this drop does not work immediately, but it does take a little bit less time than the others. So typically we're looking at around 2 weeks to show some improvement in dry eye symptoms for patients. And if patients continued to take it, they noted more improvement around day 42 as well as around day 84. So this is around month 1 and month 3. Again, depending on your insurance, coverage can be very different for people with different insurances. So you're gonna have to call your insurance company and talk to your doctor about what may be covered for your plan. A fourth prescription eye drop that can help with dry eye is an eye drop called MIEBO. MIEBO came out in the spring of 2023, and it is a prescription eye drop that helps with dry eye disease by stabilizing the lipid layer or the fatty layer of the tear film. This actually helps dry eye because it prevents tear evaporation, meaning that the tears will stay on your eye's surface for longer. One of the downsides is that you do have to take the drops 4 times a day, which can be a lot for people who are already using artificial tears and other dry eye treatment. The upside is that you can start seeing results in 2 to 4 weeks. For some patients, this drop, again, may not be covered by insurance, so be sure to check on that as well. Remember, as mentioned earlier, you can also treat blepharitis with warm compresses and eyelid hygiene, and treating blepharitis can help to improve tear evaporation as well. If you're experiencing dry eye, be sure to talk to your doctor because in addition to all the things mentioned in this video, there are other treatments available in the office like punctal plugs as well as IPL, both of which can be very helpful in managing your dry eye disease. Hope you found this helpful. Remember to hit the subscribe button below, and thanks for watching.